Sam, we know you're there.
Right. He can't get our picture up, that's it.
Right, no problem, Anne. Right, good evening and welcome to the West Neighbourhood Forum. The forum is made up of elected.
Just put it back and leave the picture.
Anne, can I ask you to put your iPad or your phone on mute, please?
Can you mute it from the admin?
We've muted it now, yeah.
Yeah.
We're muted,
yeah. Right, thank you. Right. Good evening and welcome to the West Neighbourhood Forum. The forum is made up of elected members of the council. I am Councillor Quinn and I am the chair of the West Neighbourhood Forum. This is a public meet. Oh, sorry, and we've got members of the council with us. This is a public meeting, and as such, this meeting is being webcast to the public. Members of the public watching the meeting can submit questions to the forum throughout the meeting using the form on the right or below the webcast, depending on your device. At the end of each item, the forum will hear questions submitted. When submitting your question, please leave your name and the agenda item or subject matter that your question relates to. Only questions relating to items on the agenda will be accepted. You can find the agenda available to download next to the webcast. The clerk tonight is Natasha Matthews, who will be receiving questions submitted by the public. Right, if we can now go over to the agenda. Have we got any apologies?
Yeah,
Natasha?
Just apologies for Councillor Newton, Chair.
Right, thank you. And can somebody move the minutes from the previous meeting on the 22nd of June?
Move them, Chair.
Right, thank you. Right, item 3 is the vaccinations, and I believe James is doing that presentation.
I will do. Thank you, Chair.
Yeah, yeah.
I'll just pop some slides up to share, just to give this brief update. So yeah, evening everybody. I think most of you know me. My name is James Mallion. I'm the Assistant Director of Population Health at the Council. So yeah, I suppose it's that time of year again, where we're obviously into the autumn now. So this is the time of year where we're really encouraging as many people as possible to take up those vaccinations for both flu and the COVID-19 booster at the moment as well. And we know this time of year is when those viruses start to circulate more. So there's more chance of them spreading. There's also a greater risk to certain groups of people, particularly people who are more vulnerable to that severe illness. So really, for those people who are eligible, it's just about making sure that they're aware of how to access the vaccine. And us, what I'm here to do today is really to come and give you some updates on the work that we're doing in the council and with health partners to try and boost that as much as possible, to get the numbers up as much as we can and to make it as easy as possible for people to get vaccinated. I suppose this slide, just a few summary points really that I just wanted to mention. I think the key thing really is that same message that I know many of you will have heard me talk about in the past around vaccination being a really safe and effective way to reduce the spread of these viruses and also to stop people getting really ill. So it's still something that I know, particularly with COVID-19, we've come through the worst of the pandemic, so we're not seeing the same impact that we have done previously. But it is still there. We still see both COVID-19 and flu is still there every winter. We're still seeing lots of people catching these viruses and getting ill. So vaccination is a really good way to, it doesn't necessarily stop everyone from catching it, but it can really reduce that spread. And it really reduces the risk that you'll be really unwell if you do catch it. So with flu, that's obviously it's offered every autumn and winter. This year, you might remember the last couple of years, while we've had COVID-19 as well, they've opened up the criteria for who can get the flu jab. So last year and the year before, it was anyone over the age of 50. This year, they've gone back to more of what was traditionally the groups that would receive the flu vaccine. So it's mainly it's over 65s, and then there's certain other groups, people who've got particular health issues, pregnant women, and young children as well. So it's offered through schools, but it's also offered to 2- and 3-year-olds, which is where people should be getting messages from their GP if they've got young children to take them along and get the nasal spray vaccine. So it's not an injection for the young kids, which is a big help. For COVID-19, obviously that's been offered in much broader programs. Previously, all adults have had that, and we're now only offering that to those adults who are most at risk. and it's typically similar groups, people who are aged over 65, and particularly people in care homes, and particular people who've got particular health issues. And again, it's all about the fact that they're the people who are most at risk of getting really ill if they catch it. So it's just keeping that message there that it's really important for those groups of people to take up that offer. I've mentioned, this isn't just about that illness, it's about stopping these viruses spreading as much and as freely as they would do. And that's part of the reason why it's offered to young children as well. It can make them really ill, particularly flu, but it's about stopping them from spreading it to other vulnerable people as well. A lot of this is set nationally. So, the types of vaccines, certainly for flu, every year they look at the type of flu circulating and look at which vaccine they need to use to have best effect. That's all decided at a national level, including the groups who will receive it. Locally, what we do, as I said at the start, we've got a health protection board and groups where we're meeting with our colleagues in general practices, in pharmacies who are delivering the vaccines to make sure they know what are the things they can do to get that message out there more, feeding back how best to try and communicate with people, to make that offer as easy as possible to access, and so that everyone knows about it who is eligible. Next couple of slides, just a very quick overview of these are figures from last year as what the uptake looked like, how many people we did get vaccinated. So firstly for flu, and you can see here, these are that PCN at the top left, that's the primary care network. So that's kind of the groups of GP practices across Tameside, and they're broadly similar to our neighbourhoods. So for West this evening, we've got the Denton PCN, which covers Denton, Droylsden, Bordenshaw. And you can see the different percentages there. This is for last year. So obviously the group where we get the best uptake for the flu vaccine is the over 65s. So you can see 79% there in Denton, which is above the GM average, which is really good. It does drop off in some of the other groups, and you can see particularly for pregnant women and some of those young children as well, we get a lower uptake, fewer people coming forward. And that's where we're really making those big efforts to try and make sure that as many people as possible know about the offer of the vaccine, but making it easy for them to access it as well. And there's lots of things that I'll come on to that we're trying to do to really boost that. In terms of the COVID booster, we've just got some general figures here, again, for last year. And the message here, really, you can see some of the groups who are eligible for this. So particularly health and social care workers want to really, encourage that workforce to take this up. And then some of those older age groups as well. And you can see here, still decent uptake, but nothing like the kind of uptake we saw during the height of the pandemic. So I think there's a little bit of people are less concerned about COVID, less worried about it than they were back when it was, having that really big impact on everyone's life. And what we're trying to do is just keep that message up about the importance of getting this vaccine and how useful it is to provide that protection. The key group really for this is care home residents as well. As we saw in the pandemic, some of the most vulnerable groups to COVID-19 when it gets in the care homes and that severe illness. And thankfully, we've maintained a really high level of vaccination, and they're always the first group to be offered the vaccine when we get a new booster that comes out as well. So we're really encouraging that we are seeing that high uptake in care homes as well. So I suppose this autumn and winter, we've, a similar programme. We're working really closely with our colleagues in the primary care network. So all the GP practices, the pharmacies as well, are also offering the flu vaccine. Everyone who's eligible for either flu or COVID or both should have received a text message from their GP practice. But we're also aware that not everyone gets that. Not everyone has a mobile phone. Not everyone will have the right details with the GP. So we're also trying to get the message out there as much as possible. And really the key is that there's a link on the final slide I've got to be able to book online, in your area. But actually, if you're in doubt, just contact your practice or go to your local pharmacy and they can help you, let you know when you can book in, the easiest way to get your jabs. And we are looking at trying to make it as quick and easy as possible this year. So if you're eligible for both COVID and flu, they'll try and do that at the same time, one in each arm usually, just to make it mean you don't have to come back to the practice twice. There's quite a lot of work to really promote this with pregnant women as well, working with maternity. So they're offering the flu jab for pregnant women when they come into the antenatal clinics, when they've got them there already for an appointment. and also with the young kids as well. I know that that Denton, Ordenshaw, Droylsden is one of the areas where they're offering free soft play vouchers for some of the parents via the GP practice. So, come along, get your children having the nasal flu vaccine, and they'll give out some of those free soft play vouchers as well as a bit of an incentive. And we're also trying lots of different things through the usual social media and some different language printed materials as well. So trying to make it as accessible as possible, really. So that's everything from me, really. The final message really is just that prompt to get vaccinated if you yourselves or other people who would be eligible. Please do spread that word. As I said, the link's there for the different websites that you can, the council website that's got all the different information on, depending on your area, your GP practice. But as I said, if people aren't able to access that, or if they're not sure, the best way is just to get in touch with your practice or your local pharmacy, and they'll be able to point you in the right direction. That's everything for me. Thank you, Chair.
Right, thank you for that, James. Have we got any questions for James?
Can't see any hands raised, Chair. There's none what's coming to the inbox either.
Right, well, thank you for that, James. Keep up the good work.
Thank you.
And I believe you're doing item 4, the joint health and wellbeing.
Yeah, sorry, that's me again.
Yeah, it is.
Hopefully you won't get bored of me. But yeah, I've got another set of slides that I'll just quickly pop up. And this is a different topic, so I'll take people through this. So yeah, this next presentation is just an update on the new joint health and wellbeing strategy for Tameside. And you'll notice there, I'll just explain the title a little bit and what this strategy covers really. So every area like Tameside, like other parts of Greater Manchester, we have to have a health and wellbeing board. So it's one of the statutory boards and committees of the council, which is chaired by Councillor Eleanor Wills for Tameside. And that board is responsible for making efforts to improve the health and wellbeing of Tameside residents. And really for that, we need to have a plan that sets out what we're going to do and how we're going to be tackling those health challenges, really. So the health and wellbeing strategy does that as well. Now you'll notice the title, I know it's a bit wordy, it's the Joint Health and Wellbeing Strategy and Locality Plan, which might not mean a lot to many people. What that means is this is also, as well as it being the plan for our health and wellbeing board for the council and all of our partners, this is also the plan for how we deliver our health and care services in Tameside. And a lot of you might be familiar with some of the changes that have happened in the NHS over the last 18 months, roughly. We used to have the CCG, the Clinical Commissioning Group, and that came to an end last year. And there's now this Greater Manchester, it's called the Integrated Care Partnership. And that is basically across Greater Manchester responsible for organising and having in place our health and care services through the NHS. That also, as much as it being across Greater Manchester, there's a lot of work that needs to happen specifically for Tameside. It's not just about one size fits all for the whole of Greater Manchester. There are certain things we need to have in place across the NHS for Tameside. And this plan also covers that, really. That locality plan is about how we're going to support everyone's health and wellbeing across the borough, but also what do those services look like in the health and care world that help us do that. So that just explains a little bit of what this is and what the title means, really. So most of what I'll focus on is just this one slide, and there's just a couple more, but this is kind of the plan on a page, if you like. So we've recently published this strategy. And what we wanted to do, and this vision in the middle, that blue box with the text there, was agreed at the Health and Wellbeing Board across all those different partners, because we've got, ourselves as the council, we've got elected members there represented, but we've also got a lot of our partners. So, the police, the fire and rescue service, our local housing colleagues, the local schools are represented, the job centre, the voluntary sector, Health Watch, lots and lots of different partners all working together to try and achieve basically that text in the middle. All people in Tameside have that opportunity for a healthy and happy life. And I think it's really important that's, it doesn't matter who they are, where they live, without facing those barriers, they can access that support when they need it. So you'll notice the boxes on the left and right hand side. So these 6 boxes are the kind of areas of focus for this strategy and the things we really want to nail down and achieve. The ones on the right, might be quite familiar. It's that life course approach that we've talked about before, giving children the best start, helping people to live well, helping people and getting the right support as they grow older. On the right-hand side, they're kind of broader areas, which are what we call the wider determinants of health. So they're the things that you don't necessarily think of, healthcare or, hospitals, doctors, but these things, the jobs that you have, are you able to get access to good work, the community you live in, tackling issues like poverty, the place that you live, can you go for a walk, can you cycle, and it's safe and easy to do that. Those things all have a massive impact on people's health and well-being. So we want to deliver really specific objectives and things to improve that situation and that environment for people in Tameside. The blue arrows going up and down, they're the kind of cross-cutting things throughout everything, which is all age mental health and well-being, because we know mental health is really important just as much as physical health, that people can have good mental health and support with mental health issues. And then the other one is tackling inequalities. And that's when I mentioned before those barriers that people face. Some people in our community, they do face more barriers, and day to day, it's harder for them to access services. And it's breaking those barriers down and making it easier for people to get that support that should be across everything we do. And that's why that is kind of cross-cutting across all this work. To deliver this, the blue bubbles at the bottom, and that's kind of the strap line of the strategy, building back fairer, stronger and together. So you might recognise that some of the language from some of the Greater Manchester work in the Mayor's office on the back of COVID, that build back fairer and build back better. The idea is this is how we'll do some of that. Building back fairer, it's about tackling those inequalities. What can we do to make our services and what we do to help people fairer? Building back stronger. We've got, if you look at health and care, some of the backlog and the catch-up in the NHS. But building back together is really important, which I'll come on to in a minute, which is about how we listen to our communities and listen to residents in all this as well. So in those 6 areas, this is just a bit of a snapshot from the strategy, one of these, colourful infographics. For those 6 areas, what we've done here is just put some data and stats around. This is why we've chosen those areas, because we've got challenges. And helping people stay well across the life. The healthy life expectancy of people in Tameside is a lot lower than similar areas, other places. We've had lots of historical challenges, issues like alcohol, obesity, tobacco. Giving children the best start in life. We know we've got an issue with lots of children who are overweight and obese. Helping people get into good work. We've got a lot of jobs that pay below the real living wage in Tameside that don't pay good wages. And it's some of these challenges, which is why we want to really focus on those areas and do more to try and improve the situation for our residents. In all of this, talking a lot about all these different things, and it is driven by some of that data where we can see this is an issue, but we also have been really careful to listen to what residents have said is important to them. So at the start of all this work, we've had lots of, there've been surveys, there's lots of work, there's really good work already, like the Inequalities Reference Group that I know Councillor Feely chairs, that's done some really in-depth work that we've used to inform some of this. There was a particular piece of work done around people with learning disabilities and how they experienced COVID and the pandemic, and how they felt that they weren't always listened to and they didn't always get information in the way that made sense to them. We've used a lot of that to inform the priorities of this strategy and how we need to work going forward. And even in developing this, the early drafts were taken to lots of public forums where we talked to people about, what's missing in this, what does this mean to you? So that has been a really key part of pulling all this together. This is just those 6 areas again that I've already mentioned. There are quite a lot of specific objectives under these. So I'm not going to go into those in detail this evening. There's a link at the end to the strategy itself, which I'd encourage everyone to have a look at, and we can make sure that's sent round as well. But for each of those, there's existing work that we're already doing. Best start in life. There's loads of work around how we support children already. We've got our children and young people's plan. We've got parenting strategy and early help strategy for families. This plan really focuses on what are the things around their health and well-being that we're not going to address unless we make a really concerted effort. So issues like childhood obesity, how do we provide more of that early support to families to help them understand how they can address some of those challenges. Some of the challenges we've got around work, how can we make jobs more accessible for people who face more of those barriers? So people who live with disabilities, learning disabilities. What work can we do with some of our partners, some of our local businesses to encourage them to maybe change their recruitment practices, and ourselves as a council, how do we make that more accessible for some of those people who face those barriers? They're the kinds of things that we've really set specific objectives under each of these 6 areas that we want to deliver over the next few years to try and make improvements for people. This slide, there's quite a bit on here, but this is a bit of that building back fairer, stronger together. How are we going to actually do some of this? And there are lots of tools. The idea is we build this into all the decisions we take. Building back fairer, as I mentioned, breaking down some of those barriers. When we set up a service, or when we think about how we support people, are we really thinking about, well, actually, if that person struggles to get to Ashton or Droylsden or wherever it is in the borough, do we need to think about where that's offered or how that's offered? And what if that person doesn't speak English, or what if that person has a disability and struggles to get out of the house? Some of those different barriers and challenges people face, are we always thinking about that? Because some of those groups that might be missing out and find it harder might be the people that need that help the most. There's lots of things around, building back stronger in that sort of health and care delivery, really thinking about, some of the challenges we see in the health system, and, getting that good access, tackling those wait times is really part of that plan. And in that, we need to make sure we're doing things like, are we keeping our workforce? Are we making sure that we're not losing staff? And that's across the whole health system, really. And then, as I already mentioned, building back together, I think that key on working with communities going forward in all of this, it's not just about me asking questions about this one document and, just taking that as read and going ahead. Going back to residents and communities and checking in, does this still make sense to you? Are these issues important to you? And there's lots of places we can go and do that. We've got loads of groups that, through our voluntary sector colleagues alone, we've already been to talk to lots of their groups and people that they work with every day about what matters to them. And I think at the back of all this, what I've not included here at the end of the strategy are the outcomes that we want to achieve. So there's lots of ways that we can measure, whether health is improving or not. Things like life expectancy, are we preventing more of those early deaths that we see linked to things like cardiovascular disease? Some of those really tricky issues that come back to some of these things around obesity, and healthy behaviours. And so we've got lots of those measures, which are ways that we'll be able to tell in the years ahead, are we making progress? And are we getting a sense that what we're doing is working? And we have already had that challenge from members at the Health and Wellbeing Board to say, well, how will I know if this is all sounds good, but how will I know if it makes a difference? And we are going to be bringing that back. Those specific objectives we've got, which is our action plan. Have we done what we said we're going to do? And is it making a difference? And to be honest, some of this will take a long time. We won't just change life expectancy in the space of a year or two. But the idea is it starts to move towards improvements and helping more of those people that need that support. So that's everything again from me, Chair. Yeah, happy for any questions. And as I said, the link is there in this final slide to the strategy, but I can make sure that's circulated to the group after the meeting as well. Thank you.
Right, thank you for that, James. That was a very interesting report. Have we got any questions for James?
So it's me, Sue.
Right, go on, Anne.
He didn't get through before. I just want to ask one question to him about the vaccines. I had a lot of calls when vaccines first started, people that were housebound and weren't online and only had a landline phone who were struggling to get vaccinated. Have we got provision now for people who are in that position to carry on getting the vaccines?
Thank you, Councillor Holland. I can answer that, Chair. So yeah, I mean, certainly during the pandemic, that was one of the biggest challenges that lots of people who were housebound, we needed to get to them urgently. And there is provision. So in each of the neighbourhoods, particularly including Denton, Nordenshire, Droylsden, that there is the GP practices. What they have is a list of the patients on their register that they know are housebound, and they need to make contact to check, do they need someone to come out and deliver that vaccine? Those aren't always up to date, if I'm honest. I do know. So we've encouraged GPs to kind of reach out to patients and ask that question. As I said, everyone who's eligible for a vaccine should have had a message in some way, but that's not going to reach everyone. The best thing I can suggest is that anyone who is struggling in that situation, who's housebound, if they try and contact their practice or get someone to do that on their behalf, and make them aware that they are housebound, they need that extra support, they should all have the facility to be able to come out to those those patients who need it to make sure they can get that. But we can certainly take any individual queries as well if there's people that are struggling with that, and need some extra help just getting in contact or following up. So happy to take that away if that's helpful.
Thank you, James. Is there any other questions?
We've got Councillor Naylor, Chair.
Right, Councillor Naylor.
Thanks, Chair. Thanks for the report, James. I'm quite keen to understand really in terms of the strategy how that complements existing strategies that are already ongoing with economy and skills team in the growth directorate, and how you will be working cross directorate in terms of ensuring that indeed we are marrying up and not duplicate any work. Thank you. And Jacob says hello.
Hello, Jacob. Thank you, Councillor Naylor. It's a really good point, and to be honest, that was one of the first conversations we had about this strategy, and making sure it didn't do that, it didn't duplicate. And what I probably didn't explain in a lot of detail was in the strategy itself, under each of those 6 areas, there is quite a detailed list of the objectives we want to achieve. But as an intro to that, what it talks about for each one. So a good example is that 4th one, helping people to get into and stay in good work. At the start of each one, it describes where other work is already happening. So we've got the working skills team and work really closely with Sarah and the team on the programs they've got. And to be honest, some of this is about supporting them because we've had some joint sessions with the Inclusive Growth Board and Health and Wellbeing Board in the last few months around how we do some of this together. And it absolutely mentioned the role of the Inclusive Growth Board, the Inclusive Growth Strategy, and some of those wider strategies, because it's not about, if those pieces of work are already trying to tackle, bringing some of that investment into the borough, those conversations with businesses, that's not my forte and not our forte in terms of health and wellbeing. But what we do need to really emphasize is that's all great, but actually if we've still got residents who are struggling, they've got maybe health challenges, some of those barriers, and I mentioned some of the examples like people living with disabilities, we need to have a sort of dual approach. So yeah, that's great if we're bringing new employers into the borough, we're getting more of those jobs that pay above those lower wages, but actually we need to make sure we call it inclusive job design. So it's making sure that it's accessible for some of those people that really do need to get into employment, that need access to that good income to help them overcome some of the challenges they face. So yeah, I suppose that's just one example of where we really are keen to do that. And in every one of the sections in the strategy, it name drops kind of the relevant areas. So things like the community safety strategy, work really closely across all of them as teams about the ways that connects. But then the idea with this is it's to pick up those almost gaps around health and wellbeing that might otherwise get missed in those different topics. So hopefully that answers that question.
Yeah, it does. And obviously now, as employment is in my portfolio, I'll be really keen to be kept across the detail of how this progresses. And of course, any support that I can provide in terms of pushing that forward, then you have my full commitment on that. So thank you.
Thank you. That sounds fab. Yeah, we'll do that.
Right. Thank you, James. Any other questions for James?
We've got Councillor Martin, Chair.
Right, Councillor Martin.
Chair, just a quick one. Thanks for the presentation, James. I'm just interested in the way that we're reviewing the strategy. I know there's going to be a lot of different ways because there's so many areas and departments and partnerships involved. So, for example, I was just wondering if you could give us an example of if, say, the mental health issues that our young people are experiencing increase, and we see in Tameside that the mental health is deteriorating over a space of time. How would we, as an example, deal with that? Just so we can understand as members. If you could give like a real life example of how we are reviewing, how effective we are with tackling issues.
Yes, thank you, Councillor Martin. I mean, that is a really challenging area at the moment, because I think we're aware that there's really high demands around some of the mental health services for young people, and that's resulting in wait times and in some challenges there. There's some of the specific objectives. So one of the objectives under the Best Start for Life in the strategy is around how we expand that kind of access to some of those services. So one example is around the family hubs that have recently been set up across the borough, and they're really a key opportunity to start to make services more accessible across the borough for residents in the place, near to the place where they live, in their neighbourhoods, in their area. And part of that is about making sure, so people like me, in public health, I'm responsible for things like the drug and alcohol service, our sexual health services, which are what we call like our specialist services. Part of the family hubs offer, and what we've committed to, is making sure that we make those accessible in those family hubs. And that includes mental health services as well. So the CAM service is specifically mentioned in the strategy and that objective around one of those services that we want to increase that access via the family hubs, so that people can get more of that easy access to someone to talk to around, and sometimes, some of the specialist services, there are wait times. It is very challenging. But that will be a way of people just having some of that easier access to get some of those answers, even to find out where things are up to. That's one side of it. I think that's quite a tangible example of what this does commit to. So that is on page 18, I think, of the actual strategy document, where it talks about that. On the other side of it, I think in terms of the broader conversation about those mental health services, it is something that I know is discussed through some of the governance we've got. So both at the Health and Wellbeing Board, we've got some of those service providers as members. So Pennine Care, who provide a lot of our mental health services, are at that Health and Wellbeing Board. And also I mentioned at the start, this kind of the NHS side of things, that locality plan bit, which is the health and care service. There's another board, which is the Strategic Partnership Board for Tameside, which is where it kind of replaces some of what was done under the CCG before. And that has also got those mental health providers around the table, where some of these challenges are actively raised and challenged about what is it that those services are doing to try and tackle some of those wait lists and some of those challenges. And that's where we're having examples that I know are coming from our children's services about, but this family is faced with this situation which doesn't work, really long wait time, just lack of answers, lack of clarity of where things are up to. And we've got, the chief exec sat there listening to this and hearing that feedback, and that real challenge for, next time we come together, we need to see an update on what progress is being made on those wait lists. So as part of the governance that sits around this strategy, those challenges are being actively picked up as well. So I hope that answers the question a little bit, gives some assurance on how we're picking that up.
Yeah, it does. Thanks.
Thank you.
Right, any other questions?
We've got Councillor Mills, Chair.
Right, Councillor Mills.
Thank you, Chair. James, I think you might have just answered it at the end there. Obviously, the document goes over a number of years. So I was wondering, how can the document progress, and how do we update it? Say, if we have a change of government and new policies, on Councillor Martin's point around mental health come in, how can we adapt that into the policy itself? But I think you might have just answered it, but if you can give me any more details.
Yeah, thanks, Councillor Mills. I mean, it's probably out of date already in some way, somewhere, and that's always a challenge. But what we've committed to is that there'll be that there is an action plan that sits under this, that sits with those. So the Health and Wellbeing Board, really clear, and that other board I mentioned. So those objectives are just listed. They will be actively updated on at those boards, how we're doing, and including those outcomes I mentioned, the metrics. I think some of that will need to change. Some of these, hopefully, we'll have done in a year. Some of them will take a lot longer. And some of them we might find actually the outcomes are getting worse. We need to add in, this is now a priority, whereas it wasn't as much before. And it's those action plans and that regular reporting back to those boards that will do that. So as much as these documents, it's there, it's set out, it's published, but it will be the active work we're doing that will evolve as the challenges evolve. So hopefully that will, as priorities shift, it will shift with it.
Okay, thank you.
All right. Any other questions?
I think that's it now, Chair.
Right. Well, thank you for that, James, for that report.
Thank you, Chair. You're welcome. Thank you, everyone.
We'll see you soon at another meeting.
You will do.
Thank you.
Thank you.
Thank you. Right, if we can move on to item 5, highways. I believe you're taking us through this, Lee.
Yes, good evening. Thank you, Chair. Yeah, I'm going to do the presentation, and Emma is kindly going to flick through the slides for me. So before I start, for those of you who don't know me, my name's Lee Holland and I'm Head of Engineering Services for Tameside Council. So what I've been asked to do this evening is to give you a brief overview on our approach to maintaining the highway, given the resources available to us. Before I start that, first of all, what is the highway? And this isn't a new proposal for Droylsden Town Centre, by the way. So what do we mean by the highway network? Well, what I can tell you, what we're not responsible as the Highway Authority is the motorway network. So we've got the M60 to the west of Tameside, and we've got the M67, which runs from Denton up through Hyde and to Hattersley. From there, we've got a trunk road, the A57, which runs from the roundabout in Hattersley through Mottram, Hollingworth and Tintwistle. So the trunk road and the motorway network are the responsibility of National Highways. We're also not responsible for any roads that are classed as unadopted highways or unadopted roads. So basically we're responsible for everything else. Next slide, please, Emma. So what does that leave us with? Well, Tameside is approximately 40 square miles in area, is 95,000 properties and approximately 231,000 residents. And to keep all them connected and the businesses connected, there's the highway network. The road is classified, there's a hierarchy and there's a classification for roads, but in total we have 760 kilometres of road, 1,155 kilometres of footway, and then basically, as well as that, we have just over 48,000 gullies or grids, as men would like to call them, which drain the highway, over 25,000 lamp columns to light the highway, over 4,000 signs, whether they're illuminated or non-illuminated. And then as well as that, we have the highway structures. So we have 159 bridges that we're responsible for and just over 300 retaining walls and structures. Next slide, please. So what does the network look like? Well, this is the network in Tameside, and the roads that are coloured there are based on the hierarchy, and there's a lot of reasons why the network is broken down into a hierarchy. Like I said, the highest level of hierarchy is the motorway network, and then the trunk roads, which we're not responsible for, and as the local highway authority, we're responsible for these. So you've got the strategic roads, the distributor roads, and then link roads, and then what is not coloured there are the residential type roads, which makes up the vast majority of the network. In terms of maintenance, the reason why the hierarchy is important is it helps us establish where we would spend our money based on demand in terms of the volume of traffic and the risk that is associated with that network. Next slide, please. Once we've established what the network is, we then value the network. This is done every year. This is the government's or DFT's toolkit, which we use. We put all our assets into the toolkit, and then it basically gives us a value of the network. And highway network is the council's biggest single asset. It's valued at 1.7 billion if it was in a good state or a new state. And at the moment, Tameside, we've got about 300 or just over 300 million pounds worth of depreciation, i.e. everything's not new or it's not in an ideal condition, and therefore the network is valued at 1.4 billion at this moment in time. The reason why this is done every year is because we need to determine whether the network is improving or it's deteriorating, and it also helps. All that data is put into the various toolkits, which helps us determine where we should be spending our money. Next slide, please, Emma. just based on the money side of things, when we do put this information into the toolkits, it does tell us exactly how much we should be investing each year in the highway network. And if you use the government's toolkit, we should be investing in the region of £10.5 million a year on the network to keep it at what's called steady state, i.e. the network isn't depreciating and it isn't getting any better. At this moment in time, we're investing around 4.3 million in the network, and that's a combination of our allowance from central government or DFT, and also what the council spends on maintenance as well. And I'm not saying this for, you know, to come knocking on the council's door asking for more money. I'm saying it in terms of these are the facts and figures. All highway authorities and the public sector are struggling in terms of the public purse. So it's more incumbent on us to make sure that we're managing those resources and spending it in the right way. So what do we do? First of all, in terms of the network, we break it down into 3 specific assets. So you've got the highways, which is the footways, roads, the drainage, and that forms our resurfacing programme. We've got the highway structures, which are the bridges and retaining walls, and that forms our programme for maintaining the structures. And then we also have the street lighting assets, whether that's lighting columns or illuminated signs. So those are the 3 categories we break the assets down into. There's also a 4th element to this, which is a separate facet to maintenance, and which is the winter maintenance or gritting, and I'll come on to that later in the presentation. That's just a recap on what I've just explained in terms of if you use the government's toolkit based on our inventory and our asset, we should be spending just under 10.5 million, and at this moment in time we're spending 4.3. And that just emphasises why we have to be so careful with what we spend, and we need to be able to justify what we spend, and we need to take a risk-based approach on what we spend. So I'm just going to quickly go through the 3 asset groups. So that's highways, structures, and street lighting, and just explain to you how we determine where we're spending the money. So in terms of highways, there are 3 types of surveys we do on the network. There's something called scanner, which is a vehicle that drives the network, and it basically looks at the condition of the carriageway, any defects, any cracking, and it also determines the condition of the carriageway below the surface. So it basically tells you what is the formation like, what's the foundation like. We do that survey on basically the distributor roads and the strategic roads and the link roads. We don't do that on the residential roads. Now that information will tell you the condition of the highway and whether it is capable of taking the number of vehicles and the type of vehicles that run on that highway. However, what that information doesn't tell you is if the surface is extremely smooth and like glass, which obviously for skid resistance and braking is not ideal. So on that network there, we also do a second survey. So next slide, please, Emma. So the second survey we do is called a scrim survey, which again is a vehicle and it's testing the skid resistance of the carriageway. And those 2 surveys combined help us formulate the data we need to analyse to determine what interventions we're going to use. Next slide, please, Emma. The 3rd survey we do is on the estate roads, and this is a visual inspection, and it's either somebody driving around in a car or walking the network and putting the data in terms of what they're visually seeing and the deterioration of the network. Now, all these 3 surveys are not done by Tameside Council engineers or employees. These are all done by independent companies, which are specialists in this type of work. They analyse the data and then they send all the data to us. Once we've got that data, then we can rate the condition of the carriageway. Next slide, please, Emma. And that is done on a RAG rating, a red, amber, green basis, and I won't read all these out. We've all heard of RAG ratings before, but that helps us determine the condition of the network. But we don't just use that data. We also use data from the engineers who do their inspections and the knowledge they've got. We also collate all the complaints or information we get from members of the public, and obviously from members too. So, and all this that comes in throughout the year is all collected, and it all feeds in to help us determine where we can best spend our money and we can get best value for money, and where we need to spend that money in terms of the carriageways and the highway and the footway, which is in the worst condition. So that's how we determine the resurfacing programme for highways. We do something very similar with the structures and street lighting. It's all based on the data, the information we get, and how we analyse that data. And it's all based on asset management principles and toolkits that we get from central government. So in terms of the highway structures, like I said, we have 159 bridges and we have just over 300 retaining walls. We have to do a survey on all them structures every 2 years. So 1 year we will do all the bridges, and then the following year we will do all the retaining walls and structures. And when I say structures, it means culverts, really, the big pipes. And then every 6 years we have to do what's called a principal inspection on the bridges, because obviously bridges are a little bit more complicated structure than a retaining wall. All that information is, again, it's put into this toolkit, which is called SABI. It's Department of Transport's toolkit. It stands for Structures, Asset Valuation and Investment. What that does, it tells you the value of the structure, it tells you the condition of the structure, it tells you basically what repairs you should be doing on the structure, and how you should be programming your maintenance program for all them structures. Next slide, please, Emma. So at this moment in time, in terms of our structures, our highway structures, both bridges and retaining walls across Tameside, you can look at the figures there. We've got some that are very good, some that are good, some that are fair. That's probably just over 60%. And then we've got just under 40%, about 38%, which are in the poor to very poor condition. Once they start getting to the very poor condition, obviously those are the ones we've got to target. And sometimes, and we've got a couple in Tameside where we may decide to put weight limits on them structures if we need to, until we've got the resources to do the full repair on them structures. Next slide, please, Emma. And again, it's something similar for street lighting. But what we do with street lighting, we have to keep an inventory of all our assets that have an electrical supply or use energy. So that's predominantly the street lights, but we also have got illuminated bollards, illuminated signs. That inventory is there first and foremost to pay our energy bill. So every month that inventory is submitted to our energy supplier, and that generates the energy bill or the electric bill that we pay for energy. But there's a lot more information goes into that inventory. And once we put all that information in terms of what type of asset it is, it's a lamp column, it's 10 metres high, it's 6 metres high, it's a steel, it's a concrete, and all the different things. And that again does an assessment of our street lighting assets, and it also tells us the type of maintenance and what maintenance we should be doing. Next slide, please, Emma. The issue with street lighting, especially in Tameside at this moment in time, is the age profile of the columns. A column the expected life of a column is 25 years. That's what the manufacturers would say, and we've got a lot of columns which are older than that. And if you was carrying out normal asset management principles, if you've got 25,000 columns and the life expectancy is 25 years, you would be replacing 1,000 columns a year, and that would cost you about 1.3 million on top of all the other maintenance you would have to do with street lighting. Our budget is around 600,000, and based on the government toolkits, we should be spending 2 million. So that shows how we have to manage the assets and the resources we've got. So in terms of street lighting, what we tend to do is we do a lot of structural testing because of the age of the columns. And if we do the structural testing and they pass the test, we get a 6-year guarantee. We also do other tests on the columns, like the visual inspections and the electric tests, which are compulsory, which we need to do. And we use all that information to use the resources as best we can. Next slide, please, Emma. those three things are what we would class as highways maintenance. On top of that, we do the winter maintenance. So in terms of winter maintenance, the season runs from mid-October to mid-April. We monitor the weather forecasts 24 hours a day, 7 days a week. We have a rota of 7 drivers on any one time, and we have a manager on. So we have 9 managers on a rota, and we have 21 drivers on a rota. And like I say, they're constantly monitoring the weather forecast. We've got access to 12 weather stations across Greater Manchester, but we also have 2 dedicated weather stations in Tameside, which we get real-time information from. And we basically use that to determine what treatments and when we will go out. 90% of the time we're doing what's called a pre-treatment, i.e. we're going out, spreading the rock salt grit onto the carriageway before the temperature drops below 0. On an average winter, we probably go out about 56 times any year. And when we go out and do a pre-treatment, we treat about 350 kilometres of the network. So if you remember at the beginning of the presentation, we've got 760 kilometres of the network. When we go out gritting, we only treat about 47% of the network. So I tell people this all the time because they think we're going to grit every single street and every single road, and we don't do that. We haven't got the resources to do that, and no highway authority does that. But we will treat the network based again on a risk assessment on what network we need to treat. Next slide, please, Emma. So that was highways maintenance, but there were a couple of other things we do which are sort of associated with highways maintenance. So we've got risk management, what engineers would call risk management. People call it pothole filling, etc., etc. And this is basically our inspectors going out, inspecting the network, and we predominantly do risk management. It's to protect the council from third-party claims. In terms of what we do, we have predetermined criteria for when we inspect. So depending on the risk, so a town centre will be inspected every month, a residential estate will be inspected once a year. We will carry out them inspections, and then based on the intervention levels, in terms of how deep is the pothole, do we need to fix it or not? And I say to everybody, my mum walks down the street and she sees 10 potholes. My inspectors walk down the street and they only see 4, because we will only be repairing the ones that meet our intervention levels, because we've got to manage the resources that are given to us. We have got a really good repudiation rate in court in terms of defending our claims, but that's basically because we stick to the inspections, we do them in the times we say we'll do them, and we generally stick to the repair times in terms of when we got to repair them defects. Next slide, please, Emma. Oh, man, I've just touched on this. So we do regular inspections on the network. There's a predetermined approach to it in terms of the risk-based approach, in terms of the intervention levels and when we do the inspections. And generally, in a year, we will do about 7,500 inspections of the footway, and we'll do just over 7,000 inspections of the carriageway. Next slide, please. And then finally, we have an on-call engineer, and this is 24 hours a day, 7 days a week, 365 days a year. So out of hours, if there's any incidents that happen on the highway, it could be a hole appears in the carriageway, it could be a road traffic collision, it could be flooding, it could be anything like that. It'll come into our call centre, and then the engineer will be called out to deal with that. What they generally do, they will make the area safe until the following working day, then that will come into the depot, and then we'll send an engineer out to inspect it, and then a repair will be done within a certain time scale, or depending on what the issue is. And then I think that's it. Any questions?
Right, thank you for that, Lee. That was a very, very good, thorough report. So thank you. Have we got any questions for Lee?
Just Councillor Naylor, Chair.
Right, Councillor Naylor.
Yeah, thanks, Chair, and thanks, Lee, for the report. Just interested in terms of the valuation of infrastructure assets that you saw in terms of the input that you go into to come out with a evaluation and also a depreciation. So I think it was something like 307 million. You say that you do it annually.
Yeah.
So in terms of understanding that process, that 307 million depreciation, is that from the previous year, or is that just an accumulation over time? But then secondly, in terms of, obviously it gives you an indication of where the work is required. So therefore, the assumption would be that once that work's been completed, that the value of that asset is then increased. So how is that taken into account when you're then resubmitting the data in order to get the following year's depreciation and asset value? Thank you.
Yeah, so to answer your question, the size of the network, the type of assets we've got, the number of lamp columns, the number of gullies, the kilometres of carriageway, footway, number of bridges, the type of bridges, all that. It's a massive amount of data, the asset. And it's all based, it's not Lee Holland's spreadsheet, this is the government spreadsheet, DFT. So it all goes in, it has to be calculated every year. So this 1.7 billion is if the asset was new or basically in good condition. It's exactly like maintaining your house. The 304 million depreciation is basically so it's comparing what your asset you've got. If it's a car, brand new, it's worth, I don't know, 30,000. If it's 3 years old, it might be worth 20,000. So the depreciation's 10 million. So based on the age profile and all the assets and the surveys we've done, it tells us basically this 304 million pounds worth of work to be done to bring it up to good or new condition. That is not every year. So if we don't do anything this year and it depreciates by 15 million, it will be telling us it's 319 million. So it's cumulative. And it works out based on the information we put in every single year, which is what we need to do. That is just the valuation. But on top of that, all the information that goes in there, it also produces basically where we should be spending our money and what condition the assets are in. And it gives us lots and lots of information what we can use to determine how we manage the assets.
Thanks, Lee.
Right, any other questions for Lee?
Got Councillor Axford, Chair.
Right.
Oh yeah, thanks for that. Sorry, that's a small person visiting as well. So you mentioned in the presentation that sorry, one moment. Sorry about that. You mentioned in the presentation that it would cost about £1 million to repair the street lights that are due for repair over a 12-month basis, but the total budget is about 600,000. So I just wanted to know, are there any, or how long a backlog is there for treatments of any? Are there any that are overdue, basically?
Sorry, did you say, is there any backlog and is there any overdue?
Yes, yeah, sorry.
Yeah, so in an ideal world, if you're looking after your assets, a lamp column, if you go to a manufacturer, they will say it'll last 25 years, and so you should be replacing your lamp columns every 25 years. If we've got 25,000 lamp columns, if they weren't all put in on the same day, then you'd be planning to replace 1,000 lamp columns each year. So after 25 years, you replace 25,000 lamp columns, and you continue to do that. Based on 1,000 lamp columns, you're looking at about 1.3 million. Now that's just replacing the lamp column. That isn't taking into account electrical testing we have to do, visual inspections we have to do. It's not about replacing the lantern, you know, when the LED blows, the drivers, the photocells. That's just replacing the actual lamp column itself. Our age profile of our columns, we've got, I've actually been here 40 years last week. Since I've been here, we've not put any concrete lamp columns on the highway. but we've got lots of concrete columns out there, so we know they're older than 40 years. We've got steel columns that are 30, 35 years old. They're well beyond their expected life. It doesn't mean they're going to fall down tomorrow, but if you was managing it the way you should, and if you had the right amount of finances, you would be replacing them older columns, and you'd look to replace 1,000 a year. We cannot afford to do that. We don't have the budget to do that. So what we do is we structurally test the columns. You wouldn't, if you was replacing 1,000 columns a year, you wouldn't probably do any structural testing because you would know they're all within their life expectancy. But we have to take a slightly different approach. We spent a significant amount of money structurally testing columns, but that is a good risk-based approach. So if there was an issue and a column collapsed, and we have had columns collapsed, and there was an issue and we was in court, our defence would be, the way we manage our assets and the way we manage the budget is we do structural testing, and we'll deal with any that fail, and then the others that don't, we get a guarantee for a set number of years depending on the test results. And that's the way we manage the assets within the budgets that we've got.
Right, thank you for that answer, Lee. Any other questions for Lee?
Oh, I think Councillor Holland's got a hand raised. Just gonna unmute.
Right, Councillor Holland.
I think they're just unmuting now.
All right.
Can you hear me, Sue?
Yeah, we can hear you, Dan.
Right, thanks. I'd just like to ask Lee, it used to cost an astronomical amount to have the columns connected up to the electricity. Can you tell me how much that has gone up, or are we still paying the astronomical amount? And also, the budget that you have now, Lee, in comparison to 10, 15 years ago, how much is it compared in value in that time? Is it a lot less or about the same? Thank you.
Well, I've actually got some good news. I don't normally have good news when we're talking about money. But to answer your first question in terms of connections, you're 100% right. It used to cost us a lot of money to do the connections because we're not allowed to do the connections. The electric supply that comes into the actual lamp column is exactly the same as the electrical supply that comes into your house. It's the energy suppliers' cables. It generally tends to be Electricity Northwest. So that cable comes into your house, it connects to your meter, and from the meter, then it's your responsibility. Lamp columns don't have meters in, and that's why we have the inventory, and that's how we pay our electricity bill. We always had to go to Electricity Northwest. It took us some years, but about four or 5 years ago, we got what's called a tripartite agreement. So that was with ourselves, the electricity supplier, and Electricity Northwest, and a private contractor. And what that means is we can go direct to the private contractor. So we get the connections. It's about probably half the price we used to do. The costs are going up because they go up every year, but it's about 50% of what it would have been if we was going to Electricity Northwest. So that's the good news. In terms of the engineers' budgets, I think we've been, dare I say austerity. I think we've been in austerity for something like 10 or 12 years. And if we go back to before then, I think the engineers' budget is probably about 50% of what it used to be. So
Yeah.
all service areas have
I'm not in,
Thanks for that. Thanks for that, Lee. I do know. I think it used.
Can I hear you?
Can you hear me?
Yeah, we can hear you,
Yeah.
Anne.
I do know that when we had direct services committee, it used to cost them, going back a long time, going back 20, 25 years ago, used to cost £7,000 just to connect the electricity up to the lamps. So I'm glad you've got a better deal now. But I'm not surprised at the 50% cut you've had over the last few years. It's a terrible situation. You do a good job, all. Oh, well and good to you.
Thank you. I was going to say I didn't know it was that expensive because we were paying about £450, £500 for a connection. It's slightly dearer now, but it depends. I don't want to get all technical. It depends how far away the cable is, but if it's within 3 or 4 meters, which it normally is in the footway, it used to be about 450. I think it's about 550, £600 now. So yeah, it's significantly less than what we used to pay.
Right. Thanks for that, Lee.
Right, thank you for that, Lee. Any other questions?
Can't see any,
Natasha, have we got?
Chair.
Thank you,
Yeah,
Chair.
can't see any, sorry, yeah.
Right, well, thank you for that, Lee. Thank you for that presentation.
Thank you.
Right, thank you. Right, we'll go on to item 6, enforcement panel activity. Sharon, over to you.
Thank you, Chair. Emma's going to present the slides for me. Thank you. So for those of you that don't know me, I'm Sharon Smith, I'm Head of Public Protection. And what I'm going to do today is quickly run through some of the enforcement activity that's been happening in public protection over the last 6 months. Thanks, Emma. So the functions, they're quite wide ranging. So I've listed the main areas on this slide just to run through them quickly. So we've got your food safety and food standards. They are food hygiene inspections, food standards inspections, complaints, trading standards, animal health and welfare, housing enforcement, environmental waste enforcement, health and safety, along with the health and safety executive. They enforce in certain premises, we enforce in certain premises, depending on what the main activity there is. Public health enforcement, environmental protection, that's your nuisance work, licensing and parking services enforcement. So that's just to give you a big overview of the functions that we carry out. So before I go on to the actual enforcement activity, I just wanted to mention that we are currently reviewing our corporate enforcement policy. The enforcement policy, the corporate one, will set out the general principles that the council will follow in relation to enforcement and prosecution, and it will outline the enforcement options that are available to us. It's an overarching policy, and under that will sit service-specific policies that will go into more detail about the legislation under them areas and the options available within them functions. So overarching, it's a draft policy at the moment, and we will be going out to consultation on it. So you'll have your opportunity to feed in any comments that you might have about that to us. Next slide, please, Emma. Thank you. The next thing to mention is that we do have an enforcement panel that meets quarterly. It met yesterday. It's an absolute excellent panel, and the purpose of this panel is to oversee the enforcement activity that we are undertaking as a council and to promote the enforcement activity, so the public are aware of what we are doing out there. So we're ensuring that we're all working together across council services. So we've got regulation, not just in public protection, we've got it in other areas such as planning, enforcement, and we need to make sure that we're joined up in the enforcement approaches that we take, and that we're also joined up with our partners, such as Greater Manchester Police. We work really, really closely on a daily basis with them. And also making sure that we're delivering on the corporate priorities and increasing enforcement across the borough where it's required is a corporate priority for us. So thank you. Next slide. So I've tried to condense into one slide the enforcement activity that we've done in the last 6 months. Very difficult to do because there's a lot that goes on. So I'll just give you a quick high level run through of this. So in food safety and standards, we've done 528 inspections. That's our environmental health officers going out doing them. We've got just over 2,000 food businesses that are registered with us. So we've done a quarter of them in the last 6 months, which you can see is a lot of activity. 5 improvement notices have been served, and we've had 3 of them businesses that were an imminent risk to health, so therefore they were closed. Moving on to trading standards, we've got 7 ongoing prosecutions. There's a lot of detail under that, but they are generally for things like cigarettes served without health warnings, counterfeit tobacco, rogue traders, so building work that's not been undertaken with professional diligence, where we've had complaints from residents about that. So they're ongoing. And then seizures, trading standards do seize quite a lot. You can see there the amounts of illicit cigarettes, tobacco and non-compliant vapes that have been seized in the last 6 months. So that's a big priority area for us. Moving on to waste enforcement, we've had 2 fly tipping prosecutions, which I'll mention in a minute. We've served 79 fixed penalty notices in the last 6 months, and we've dealt with 1,747 service requests, people concerned about fly tipping and waste out there on our streets, which you can see is a significant amount, again, of complaints and work. Parking, we've issued 9,376 PCNs for parking and 1,371 PCNs for bus lane enforcement, bus lanes. Moving on to environmental protection, we have dealt with 722 requests for services. This is our nuisance complaints, can be anything from noise complaints to odour to smoke, etc. We've served 18 abatement notices for statutory nuisance throughout the investigation of them complaints. In housing standards, all these areas are big areas of work. Housing standards, we've dealt with 152 requests for service from the public. We've done 11 inspections under our Homes for Ukraine work, and we've done 67 HMO inspections, houses in multiple occupation. And then finally, you can see the amount of licenses we've issued in the last 6 months, well over 1,000 licenses. So yeah, that's just to go through some of the enforcement highlights for you then. The first one, Bacon Butter Cafe, this was a health and safety prosecution that was taken under the Health and Safety at Work Act. It was a petrol generator that was operating in the basement. Unfortunately, it resulted in 3 people being hospitalised. It was a serious issue, and hence you can see from the sentencing at court, there was an 18-week custodial sentence given for that, and it is quite rare for us to get custodial sentences. They're usually fines. So yeah, so we had that. Trading standards, Operation Wagtail. Operation Wagtail, this is where we use a dog that can sniff out counterfeit tobacco, which is really useful for our trading standards officers when we're going in doing our visits and our inspections, because it can sniff out the cigarettes that are being hidden that we perhaps wouldn't find. It's amazing where we have found cigarettes being hidden in manhole covers outside, etc. So it's really useful, this dog, and you can see on the 26th of April what we seized there, 472 packets, cigarettes, etc. We're still doing our underage sales operations for those businesses that we've got intelligence that they are selling to under 18s. And the last one, we visited 25 businesses. All them businesses, we will have had some kind of complaint or allegation that they were selling to minors, and we found 3 of them to sell to us. So enforcement action will be taken against them businesses. Thank you. So next slide. The waste enforcement, we do regular waste enforcement days of action, as you're probably aware, and they are very successful in terms of getting everybody together to help with this. And we've issued a lot of fixed penalty notices in the last 6 months as a result of them waste enforcement days of action. So they're very successful. This year, we've actually served 110 fixed penalty notices so far for fly tipping. And as I mentioned before, we've had a couple of waste prosecutions, as you can see there. and we've got a number of other prosecutions in the pipeline. And then moving on to licensing, we've had two applications refused by Speakers Panel in the last 6 months for drivers that didn't meet our fit and proper test. Finally, antisocial behaviour team, they've dealt with 178 interactions of antisocial behaviour between January and August. 21 fixed penalty notices have been served for the Ashton Public Space Protection Order that we have in place. We have also served 4 community protection warnings and 3 community protection notices, and this would have been in relation to neighbourhood antisocial behaviour complaints that we've received and investigated. So that's my presentation. I'm sorry I've whizzed through it very quickly, but if anybody, I think my email details were on the next slide, but if anybody has got any questions, happy to take them now. Otherwise, I'm happy for you to contact me separately. Thank you.
Right, thank you for that. Thank you for that report, Sharon.
You're welcome.
Any questions for Sharon?
Yeah, we've got Councillor Mills, Chair.
Right, Councillor Mills.
Just very quickly then, Sharon, on the introduction of the single-use plastics ban on the 1st of October, obviously a lot of work went into working with businesses before this law came into force. What enforcement, if any, are we doing, or are we leaving it? Are we giving it a bit of grace period? Are we doing anything around that, please?
So yeah, this is something we're going to be looking at. I've actually got Bev, who's our environmental health manager, on the call. So Bev, do you want to just answer that question?
Hi, yeah, can do. So we are giving a little bit of grace period. There's a little bit of where they've got some permissions really to use up some old stock. So for a short while, we will still see some plastic cutlery and plastic uses within the businesses. But once that grace period has passed, then obviously then we will be, we will be looking at some enforcement options. But I think initially it's making sure that, the right messages are being provided to businesses and that engagement options really before we look at enforcement. But yeah, bit of a grace period at the moment.
Yeah, because I think that's key, because obviously the cost implications on businesses and everything else that's going on. While I agree with the ban, don't get me wrong, I'm glad to hear that. Thank you, Bev, and thank you.
Thank you.
Right, any other questions for Sharon?
Can't see any more, Chair.
Right, well, thank you for that. No more now?
Oh, no more, Chair.
Right, thank you for that report, Sharon. Keep up the good work, you and your team.
Thank you.
Thank you. Right, we'll now go on to item 7, the Droylsden plan. I believe Damien's taken us through that one.
I am, yes. Hopefully you can see my screen. Let me just share that with you. Can everybody see that?
Yeah.
Yeah, brilliant. So, hello everybody and good evening. My name is Damien Cutting. I'm the Economic Growth Lead at Tameside Council. I will have met some of you before on this call, but I think there's a few that I haven't met. So, I sit within the Investment Development and Housing team under the Place Directorate. And good news, we're looking to prepare a master plan for Droylsden Town Centre. And I'm just going to give you a bit of information. I haven't got many slides on this, and this is just basically because we're at the very beginning of the process. So in terms of the master plan and in terms of why we need a master plan for Droylsden, I think everybody's aware of the issues that town centres have faced across the country, in terms of vacant units, a reduction in footfall, that poor quality environment we associate with a lot of town centres, antisocial behaviour, which we've just previously touched upon, limited nighttime economy. Now, these are all issues that are not specific to Droylsden, they're not specific to Tameside, they're specific to a lot of town centres across the country. So the council are putting a commitment in place in order to regenerate our town centres. You'll have seen a lot of press recently in terms of the Levelling Up Fund for Ashton Town Centre and Staley Bridge, the master plan that we're looking at developing for Hyde, and it's Droylsden's turn now. So we'll be looking at preparing a master plan over the coming months. But just going back to the town centre and the reason why we need a master plan, there are issues in Droylsden town centre. There's some brilliant assets, and we'll be looking to make as much of those assets as possible. But all those that you can see there in terms of those bullets, a lot of them are relevant to Droylsden town centre. But again, you know, the growth in online shopping, out of town shopping centres, the COVID pandemic and the cost of living have all had an impact in terms of town centres, the way they function, the changing behaviour of people and how they shop. And that is a lot of, you know, in terms of the aspects that we're looking at with town centres around rejuvenation and reinventing our town centres. These are all the things that we're looking to include within the master plan. So this really is an opportunity for change for Droylsden. You know, as I mentioned, there's a lot of assets associated with the town centre. It's strategically well positioned. It's got the Metrolink, it's close to the M60 and the city centre, it's close to the other town centres within the borough. And we're looking to really capitalise on some of the changes, particularly within that city centre in the East Manchester area, the Co-op Live Arena, and just understand really what that can mean for Droylsden and how we can capitalise on that. So the council recently secured £100,000 of Greater Manchester Combined Authority Evergreen funding, which is great news. And we're looking to use that funding in preparing this master plan. We'll be looking to appoint a consultant team, and we're actually out to tender for that at the moment. The deadline for submissions is next Friday. We'll be looking to review them as a part of our team, as a panel, the following week, and hopefully we'll be looking to appoint somebody by the end of this month, beginning of November. And then the master plan in terms of the completion, there'll be a lot of work obviously in between that, and I'll go on to some of that in a second. We'll be looking at the spring next year in terms of the completion of that master plan. So in terms of, just to give you a bit of an insight of what the first stages might include, a lot of it will be really about evidence finding and fact finding really for the town. So understanding what the local priorities and ambitions are of the local community and key stakeholders, understanding what the issues are. So there might be some of them that I mentioned on the previous slide. There might be others that we don't know about, but also building on that and understanding what the opportunities are within the town to really regenerate and rejuvenate itself. We'll be looking to undertake quite a significant amount of consultation and engagement. That likely will tend to be through surveys, websites, drop-in events, and we'll be looking at an engagement strategy, setting out an engagement strategy right from the very start. So we'll be able to share with people how, when, and who we expect to consult with through that time period. And those dates for the consultation events are yet to be confirmed. So by the end of it, what are we looking for? Well, we'll be looking for an approved master plan for the town centre. The likelihood is, and that we'll be flexible with that master plan in terms of what we want to achieve with it. We've got a broad criteria in terms of what we want to achieve, but we want to ensure that it's flexible enough to meet competing and conflicting demands through that preparation of the master plan. But ultimately, we'll be looking to identify opportunities for change, opportunities for development, strategies for movement and connectivity, so how the town functions, how people interact with the town, how they access the town and move about while they're in the town. Ultimately, we want to regenerate the town and bring vacant units back into use. We'll be looking at a public realm strategy, and again, that links to that strategy for movement and connectivity, but looking at the public realm, the quality of the public realm that exists there at the moment, and how we can potentially improve that public realm going forward. We'll be looking at the links to the green space assets and the blue corridors, which we class as the likes of, lakes, rivers, canals, and Droylsden's very fortunate to have the marina area. So we'll be looking to understand how we can capitalise on that. I have to point out right from the beginning, and it sounds, a bit of a negative point this, but really it's just about understanding what the expectations are for the master plan, and that there will actually be no funding available at the moment to deliver any of the identified actions through that master plan. You might ask the question in terms of then, why are we doing a master plan for Droylsden? What's the point if there's no funding available? But you find through this process that as you start to prepare a master plan, there starts to be a lot of interest gathered, whether that's from the private sector or the public sector, and it can be investment or it can just be support. But we found it with a lot of the other town centres that we're working on, and the experience I've had in previous jobs in terms of the town centres. We do get asked that question a lot of the time in terms of when the funding, isn't available from the start. Ashton is in that fortunate position. It has got that levelling up fund behind it, but there are other town centres that don't. Hyde is one of them at the moment, and Drawsden at the moment is another one. But that doesn't mean to say that we're not looking to deliver any change within the town. As I said, we'll be looking to kind of rejuvenate the town centre through some early actions, but also it will be a longer term strategy for the town centre. So the likelihood with master plans tends to be around 10 to 15 years. Now, I know that seems quite a long time, but actually, you know, for real change to happen, it does take some time. But again, even though it's a long-term plan, we will be looking at some short-term interventions for the town centre too. I did mention it was quite a short presentation, and that really is just because we're at the start of the process. We'll be looking to obviously speak to the local community, speak to local members, speak to key stakeholders. You'll see more detail in press releases coming up. We'll be looking to publicise when those consultation and fact-finding and engagement events will take place. And as soon as we've got that information, we'll let people know about it. But looking forward to getting to know people within the town, looking forward to get to know the key stakeholders, identify who they are. Yourselves as ward members as well, looking forward to get to know you and understand what your priorities are for the town centre and how we can factor them into the master plan. So thank you for your time. Happy to take any questions as well.
Right, thank you for that report, Damien. Have we got any questions?
Can't see any at the moment, Chair. Can't see any hands raised or... Yeah, no, nothing. No questions.
Right. Well, thank you for that.
No worries. I'm sure people will have a lot more questions as we start to, when people have got something a bit more tangible to say.
Yeah, no, we definitely have, but they'll come later on when you know, when the consultations and that start taking place. But thank you for the report. Thank you.
No worries.
Right. Item 8 is the date of the next meeting, which is the 25th of January. So thank you all for attending the meeting this evening and enjoy the rest of the night. Thank you.